within the populace, the general country and people. Pool testing is not a taboo in molecular science, basically. So pool testing simply means that you have a pool of samples. So take, for instance, you have 10 samples. I'm going to use this diagram to explain what pool testing is. Mind you, this is the source of this particular figure here. You can see individual samples here, individual samples 1 to 10. You take 200 microliters into a new tube. Now again, you have individual samples again, 1 to 5, 1 to 10. You could take 200 microliters again into a new tube. This is 5. So you could either do pool of 10 or pool of 5. Now when you go far to your test, you could see that here you have 1 coming out as positive. So it implies that 1, 2, 3, 4, within 4 hours you run this test, you are able to pull out 4 or 5 samples where 1 comes out positive. Now if 1 comes out positive, it means that you need to go back again to run this particular analysis individually. But if all of them comes out negative, it means that you've tested all of them to be negative completely. However, people will tell you that, oh, what is the role of asymptomatic individuals? And also, can we also say that, oh, is this particular test sensitive? The answer is yes. So for qPCR, it can actually peak 0.001 nanogram per microliters. That is really, really low when it comes to concentration. Yet the machine is still as specific as 86%, and at the same time, it's as sensitive as 95%. On the ground that you carefully optimize your protocol. So what the government should do going forward is to go back into the laboratory and carefully optimize the protocol that will then integrate pool testing and individual testing. Again, pool testing is being done almost everywhere now. Countries like India with 1.3 billion population, there are some states in India right now, they are into pool testing. Recently, OHAM, they targeted, I think, 11 million tests, and I think they were able to hit 1 million in one single day. And also, pool testing is integrated. You can only do pool testing when you think your level of positive cases is within 1% to 5%. You could do pool testing. Now, the figures we have, can we actually integrate that into the entire population and come up with a percentage of effectivity? The answer is no, because we have a weak number. I think in Edo State is about 4.5 or 5 million people, and they've only confirmed barely 256 tests thereabouts. You could check NCDC for the right numbers. Again, can we then use that particular numbers to integrate into the population and say we are at community spread, community infection or transmission? It's here and there. It's here and there. You can't really say we're at community transmission when you do not have the numbers. When it comes to numbers, that is testing, you do not have the numbers to be able to ascertain where we are actually. So pool testing is actually possible when you have the right mathematical model, which I do have, if any government is interested, to share with them on how they could integrate pool testing and individual testing going forward to ensure that we bring this particular virus into control. Now, here's the magic about ramping up our testing capacity. Now, this is a clear example of what pool testing is. In pool testing, if you have 384 well plates, so imagine you have a sachet of paracetamol, you take out all the tablets, then you have little wells inside. Imagine those little wells into 384 platform wells. So you need to fill up that wells one after the other. So in pool testing, if you are batching up 10 samples to become one sample, it means that you're going to have 3,840 samples at the end of this entire plate. Again, how long to run a plate? So basically, if you want to really do this particular experiment, let's say you have your RNA extracted, you have your cDNA, everything is ready. Now, from the point of loading the plate up to the point of the machine running the experiment, give or take, could last for 4 hours. Like I said before, for me, it could take me 2 hours to load this particular well plate within that particular time frame. And if the machine is to run for 2 hours, that is 4 hours. So one plate runs for 4 hours. That's to load everything in 4 hours. How many 4 hours in 24 hours? That is 6 hours. Now it means that you could run 6 plates in 6 hours. 6 hours times 384, times 3,840, it means that you've done 23,040 samples in 24 hours. Now, what is the level of positivity and negative results? From the NCDC data we have, if you do the maths, it says that the level at which you have a positive case is at 17.2% when I did this math this morning. Now, when you integrate this percentage into this, you're going to have 3,962 coming out as positive. So it implies that you need to rerun every single well that comes out positive, which has 10 batch of samples. Again, when you subtract 23,040 from this number, you have 19,077.12 negative. So it means that you've successfully run in 24 hours, you've run this particular number of negative samples in 24 hours, which is really huge because you are trying to quickly identify individuals, especially the super spreaders, which are asymptomatic individuals, carefully, immediately out of the population. Let's take a look at individual testing. Again, 384 well plates, you can load 384 samples straight on. How long to run in one plate is 4 hours, like I explained. In 6 hours, you're able to do, in 24 hours, you're able to do 2,384 in 24 hours. At 17.2%, that is 396, I guess, 0.28. Then, then when you subtract this from this, you have somewhere around 1,907 negative cases. So basically, in 24 hours, you're able to tell the nation that this particular set of individuals are positive clearly in 24 hours. You do not need to go back to run them all over again. In that same 24 hours, you're able to say 1,000 plus are negative in 24 hours. But here's the magic. How long to achieve 23,040 is going to take you how many hours? It's going to take you 240 hours. Now, that's if you're doing individual testing, it's going to take you 10 days to pull out these numbers. 10 days to pull out this number. But if you go by pool testing, it's going to take you just 24 hours to achieve 23,040. Remember, there's a calculation that is not appearing here. Now, if you want to rerun this particular test again, to rerun this test of 3,962, basically you need 10 plates to run that. You need 10 plates to run this. So if you do 10 plates, you then multiply it 10 plates. So in 6 hours, you're able to run 4. So it means that within 12 hours, you're able to rerun all of these samples again. Whereas in individual testing, it's going to take you 10 days to achieve this, which is clearly showing that you can be at optimum speed when it comes to using a two-way strategy to ramp up your testing capacity. And that is what we need to do going forward. I'm very sure there are some states in Nigeria that the level of the virus is really within 1 to 3%. Now, why is testing important? Testing is important because we need to know who are the individuals with this particular virus among the population. Because if we do not know these individuals, it's going to affect the economy, it's going to affect our normal standard of living, it's going to affect so many things in the country. At the same time, say for instance, most countries are out of the wood and we are still in the wood, you may likely not be able to fly to UK, to the US, if your country is still prone to COVID-19. So we need to really speed up quickly. Here are my recommendations. So